Welcome to this essential guide on rubella, commonly known as German measles. We'll cover everything from symptoms to prevention. Rubella is a contagious viral infection caused by the rubella virus. It's an RNA virus that often results in a mild illness for most people. While usually mild in children and adults, rubella's quiet spread and potential for severe effects make it a major public health concern. The true danger of rubella lies in its impact on pregnancy, where it can cause a devastating condition called congenital rubella syndrome, or CRS. Understanding how rubella spreads is crucial for containment. Let's look at the contagious period and routes of transmission. The incubation period, from exposure to symptoms, is typically between 14 to 21 days, averaging about 17 days. People are contagious about 7 days before the rash appears until about 7 days after. Many infections are mild or show no symptoms at all, allowing the virus to spread silently. Rubella primarily spreads through respiratory droplets released from coughing or sneezing and direct contact with nasopharyngeal secretions. Remember, humans are the only reservoir. Now, how does the infection progress in the body, and what symptoms should you look out for? The virus enters through the respiratory tract, replicates locally in the lymph nodes, and then spreads through the bloodstream, a process called viremia, to the skin and other organs. Typical symptoms are mild, including a low-grade fever, general malaise, mild conjunctivitis, and upper respiratory issues. A key feature of rubella is tender swelling of the lymph nodes, particularly behind the ears, at the base of the skull, and in the neck. The fine, pink maculopapular rash begins on the face before spreading down the body. It usually fades quickly within 3 days, earning it the nickname, quote, 3-day measles. The most serious consequence of rubella is congenital rubella syndrome, or CRS, which affects unborn babies. If a pregnant woman, especially in her first trimester, is infected, the virus can cross the placenta and transmit directly to the developing fetus. CRS can cause severe, lifelong disabilities, including sensorineural deafness, cataracts and other eye defects, congenital heart disease, and intellectual disability. Let's review how rubella is diagnosed and the current approach to treatment. Diagnosis relies on clinical suspicion backed by laboratory confirmation, typically through testing for rubella-specific IgM antibodies or PCR testing. There is no specific antiviral treatment for rubella. Management is supportive, focusing on rest, fluids, and medications like antipyretics for fever and analgesics for joint pain. The good news is that rubella is highly preventable, thanks to effective immunization. The MMR vaccine, which protects against measles, mumps, and rubella, is critical. 2 doses provide long-lasting immunity and have dramatically reduced global rubella and CRS rates. Because the live rubella vaccine is contraindicated in pregnancy, women planning to conceive must verify their immunity beforehand to protect themselves and their future child.